In the last 5 years, we've been trying to track the most common ailments that affect our registered children. And last year, this analysis showed that there were 3 major clusters that is comprised of 18 projects that were battling with jigger infestation. That's when we decided we should do a campaign, because initially we've just been dealing with the few cases that are reported at the project level.
We felt that it was important for us to address this because it was a paramount need that had direct impact on whether or not we were able to achieve outcomes.
Bearing in mind that we are living in a modern era, it was a bit shocking to find that we are having jiggers amongst our registered children. And worse still is that their families were affected too, and we could not be able to do much about them at that particular point.
Coast Province is actually second from Central Province in jigger infestation. And in Malindi, so far, we have registered 8,000 children who are jigger infested.
The total number that is affected in the 3 clusters, we were actually going out to reach 1,380. The approach is to do training, just to train first the church. That is inclusive of the child development workers and the church partner committee on the issues of jigger infestation. And the children, very critical.
Through training, we're able to educate people on how to identify, how to treat them, and how also to prevent the jigger from occurring. Also, we are going to train them on how to be able to keep proper and good hygiene.
We started in 2007 working with jiggers in central Kenya. Slowly by slowly we came out to know that the problem is just not in central as we thought, but it is larger than central. It's in the whole of country, it's in the whole region, it's actually in Africa.
There was need to partner with AHAD Kenya. Reason being, AHAD Kenya are the experts in anti-jigger campaign, and they have been very effective in carrying out such campaigns.
We are using this method we call winless and painless. First of all, on our gloves.
In the 3 clusters that we targeted, the causes for the high rate of infestation, the main cause is poor hygiene. People are lacking water, and the issues of bathing, keeping their feet clean, and even observing general personal hygiene. And number 3 is also lack of awareness, education. The treatment of jiggers takes about 2 weeks, and it means that every day, 2 times a day, somebody needs to soak their feet in the solution that is prescribed.
This is potassium permanganate. It's a solution that when you mix with the water and you soak the feet or whichever part of the body for 15 minutes, you suffocate the fleas. Jigger infestation has quite a number of effects. If you have AV infestation, then you become anemic, the blood level in the body is reduced. And that also, with anemia, you are also prone to many other infections. Like, for example, malnutrition. Without knowledge on management of jigger infestation, some families could be using needles, to try and prick the body to be able to remove the fleas. And as they prick, they cause wounds. These wounds can be infected. You can get illnesses even like tetanus. Because of the poverty, not everyone has their own needle, so they will share the needles. And if there is another infection, for example, like HIV/AIDS, that is transmitted from one person to the other one. The other problem is it renders our children probably unable to walk because of the disfigured toes and the feet, and they are not able to walk to school. And this causes school dropouts. It's a disease that people don't like to be associated with. And as these children are going to school with their feet, going apart like this, what happens is the others laugh at them and they are not, they lose that self-esteem. For the adults, for example, those who have to go to work, probably work in their farms, they have heavy infestation. It renders them so helpless. They are not able to continue their daily life, so they are not able to earn any living. I think those are very, very critical effects of jigger infestation, especially when the infection is quite heavy.
The reason why we have trained trainers is for those trainers to go and treat the caregivers. They treat the guardian, the parents, the sisters, the brothers of those who are affected, so that there's continuity and there is easy mobilization of the communities.
We have trained 36 of them from 18 churches, so those are like our lead trainers.
One thing that was really surprising about the jiggers, we learned that the jigger can have up to 900 eggs. And you can imagine 900 eggs, what they can do to the community. It means if you have one jigger, you can infect other 900 people. Especially if the community around there's no hygiene, it means the whole community can suffer jiggers because one gives us 900 eggs.
We've been able to network with even the local public health officers who are in charge of those particular regions, to have even the issues of hygiene improved, both in their schools where our children go, and even in the church and even in the community.
So far, we can see that the outcome of the campaign is good because the people who are trained already, they have already trained the family members of those who are infested, and they are able now to start treating the people, and they have been provided with the materials that are required. We endeavor to continue conducting the screening and target those who are affected, raise proposals, partner with those that we need to partner with in a bid to make sure that jiggers are eradicated amongst our registered beneficiaries.
This campaign will mean we'll be able to reach many people, and we believe that by reaching them, we can eradicate this problem, with the jiggers problem.
Our churches who are working with these members, if they can also have forums in church whereby they can discuss about these things, I believe many families will get this information and they will do something about jiggers.
We will continue to intervene as the needs arise, but one of the major interventions that we are targeting that will have a long-term effect is that of education and awareness creation, so that there will be a total shift towards issues of behavior change, culture change, and we think that that is a long-term and more sustainable approach.
My recommendation to Compassion is that let them continue doing the good work of supporting the community, and through this, I know God will do something great.
We are so much grateful for the move they have taken to us, because in a way they have helped the church in reaching this community. With their support together, if we join together and continue together in working and reaching these people, then we shall help the community.
What I can call on other churches is to join in, get the example that has been set by Compassion, so that many more people can come out. As much as they are going to get the spiritual food, they can also get healed out of jiggers.